Social connection is really important for men's mental health, and our social relationships are really, from a young age, what defines what it means to be a man. But as we see, as men get older, their social circles get smaller, it can become harder to make those connections. There's a long history in supporting people in general in the community, and it can be a really appealing context for men that may not necessarily want to reach out to professional help. So having a strong social circle and being able to rely on peers, get their experiences and perspectives can be really valuable. But we know it's not quite that simple because developing those strong connections can be challenging. There's barriers to that. There's some fear that's associated with that, especially when you're talking about mental health challenges and the degree of vulnerability that one might have to express when they're asking for help. Guys don't know how someone else is gonna respond necessarily, whether they're gonna be ridiculed for that or whether they're gonna be genuinely open to listening and helping them. So I think a lot of the focus around men's peer support for mental health so far has really been about getting men to reach out or getting people to check in with each other. You know, this idea of "Are you okay?" and "Bell Let's Talk Day." It's important because it raises awareness for mental health, but I think there's probably more complexities to these interactions than we're really giving credit. And some of the guys that we've talked to have really expressed that they're quite planned and they're quite purposeful and calculated in the interactions that they have. There's more to it than just asking. They need to make sure they're in the right setting. They need to make sure that it's a relatively safe space that the person's gonna be willing to open up. It can be sometimes hard to find the words to express ourselves, and so you need to read between the lines to determine what's really going on with the person that you're talking to. And after all is said and done, the person providing peer support still needs to make a decision around what the next step is. Do you encourage that person to get more help? Do you follow up with them yourself? What are some benefits and pathways that you can provide to this person?